Well, it's interesting. I love baseball. I grew up a big Red Machine fan. I went up and did my residency in Boston, and that's right when Roger Clemens was in his heyday. And I love baseball. So I went down and spent a year with Jim Andrews down in Birmingham and learned how to do it. Came back to Cincinnati, and that's all I wanted to do is take care of the Reds. And there was an opening. Somebody wanted to have somebody down there more full-time, maybe a younger guy, somebody with some experience in baseball medicine. So I met with Jim Bowden, the general manager, and kind of went through a grueling interview. And I told him I'd be at every game. I'll take care of all the guys. And nobody believed me back then. Now, you won't do all that. Well, I did. So 30 years later, here I am.
I know. That's fantastic. You go to every home game, and you made a bunch of road trips as well. All right, so guys start coming to you, the Barry Larkins, the Ken Griffey Jr.'s. Describe Ken Griffey Jr.'s hamstring injury, because, I heard things publicly. I was now doing radio and television back then. Did you really screw his hamstring to the bone?
Yeah, that's a very funny story. He's in San Francisco, and I'm watching a game on TV, and he kind of does the splits and kind of comes out of the game. And trainers called and said it was his hamstring. Well, back then, in the early 2000s, hamstrings, you don't MRI them, you rehab hamstrings. Well, he kept hurting, and I'm driving in a car one day, and the phone rings, and it's Junior. You know how Junior would call, he'd go, yow. He goes, this isn't any better. So he's Ken Griffey Jr. So we MRI it. And the MRI showed the bone tendon completely off the bone, a whole string of hamstring tendons, 3 of them. I didn't know what to do. So I sent him down to North Carolina to somebody who's done a bunch of these. He agreed. Griffey went down there with the head trainer, Greg Lynn. And the next day he knocks on my door and he goes, okay, you're doing this. I said, I've not done one before. He goes, well, I trust you. Da-da-da-da-da. And I said, okay. He goes, go to bed early, read the books, and we'll do it tomorrow. Okay. So I did it. And we opened up his hamstring. I repaired it, screwed it back into the bone. The hardest part about dealing with him was not that, is that we had to get a little bit of a device for him to get around. Unfortunately, it was turquoise, and that didn't go over so well. He said, I'm not using that. So my kids had to take it home and trick it out, blacken it, and kind of make it look at something he could go in public with. But yeah, we screwed it back to the bone, and give Junior a lot of credit. He worked hard, and he came back. He was comeback player of the year the next year. So I give him a lot of credit. It was a tough injury that he fought hard to come back.
Talking to Dr. Timothy Kremchek, orthopedic surgeon for the Cincinnati Reds. All right, so tell me about Tommy John surgery. And like you said, you had never done the hamstring one, so that was a first for you. What was it like for them in the mid-'70s, 1975? Just try to go back in time as a doctor and think, okay, we're going to do this experimental surgery. We don't know what the outcome's going to be, but we have to try it to save his career. What do you think was going through Dr. Frank Jobe and Louis Yoakum and all the other guys that were in that surgical theater when they were cutting open his elbow?
Well, I got to know Frank Jobe quite well. Obviously, the later stages of his career, and I got to know Tommy John actually quite well. And the story is compelling. They know that they had lost a lot of players earlier to elbow injuries, a la Sandy Koufax in Los Angeles, and it most likely was a ligament tear. They didn't know what to do with it. He had developed arthritis in his elbow and had to quit at an early age. So they didn't have MRI machines, but Dr. Jobe knew it was the ligament in the inside of his elbow. And Dr. Jobe had actually had a lot of experience dealing with polio patients. And polio patients, you have to actually take the tendon and transplant them and turn them into ligaments and help support, oftentimes the lower extremity. And he told Tommy, he said, I don't know what to do, but this might work. We'll give it a try. And Tommy John says, I don't want to go back to Indiana. I don't want to be a farmer. I want to continue to play. He's super young, but he wasn't old, and he wanted to continue his career. And the beauty is he didn't throw it 100 miles an hour. So he's into it. And so they did it. And, it's interesting. The first one really recorded being done is certainly a first major league player. He had ulnar nerve symptoms a year later, and they had to move his ulnar nerve like many of us do now. But the interesting part about this whole thing was that the rehabilitative process that he went through in 1974, as far as throwing, coming back, get to the mound, and get to the big leagues, is almost exactly what we do today. The same. I mean, obviously, we throw some modalities with the shoulder and core and do some, crazy new nuances with machines. But for the most part, the rehab and coming back, the throwing, the process is exactly as we do in 2026.
That's fantastic. And how many different sports do you do Tommy John surgery on?
Well, it used to be, the hard part is for people to understand when you injure that ligament, who needs it, who doesn't. And now, with the success of the surgery and what we've learned about it, and what we've learned about rehab, we're seeing more and more, obviously, gymnasts, softball players, volleyball players. I've seen golfers, obviously, when you have to use that ligament. So swimmers, so any athlete that's placing the stress on the inside part of their elbow and they having pain and discomfort and change in the way they swing or whatever they do, it's a great operation to actually fix it. Now we have a number of different ways to fix them. But certainly the outcomes and the protocols are pretty much the same as what Tommy John went through, and they're all very successful. I mean, not all of them, but certainly a high success rate.
Talking to Dr. Timothy Kremchek, one of the best orthopedic surgeons in the country. Let me ask you about that because, I still coach 15-year-old to 18-year-old AAU baseball players. One of my 15-year-old pitchers, he's a pitcher-catcher, needed Tommy John. They took the ligament out of his same arm. Now, describe that you used to take it out of their leg, their opposite wrist. When did you start taking the ligament out of the same pitching arm and putting it in the elbow?
Well, actually, that's been done really for the last 40 years. I mean, really, right in kind of in the mid-'80s. I mean, Tommy John surgery didn't pick back up. Tommy John had it done. He was successful. And there were only a handful of people in the early 80s that actually had the procedure, I believe 10 major leaguers. But we found that the tendon we call the palmaris longus, when you take your little finger and your thumb and you push them together, you can see a tendon that pops out. Now, about 30% of people don't have that. But that tendon is oftentimes the right girth, the right length that you can actually make a new ligament. Now, when you do a Tommy John, you take that ligament, you drill the proper holes in the right area in the inside of the elbow, and you're basically replicating and turning that, taking a tendon and turning it into a ligament. Over a period of time, the body breaks down that tendon, and it becomes a ligament, much like the ACL, where you take a tendon like the patella tendon, you make a new ligament, and over time, the body breaks it down and turns it into a ligament. So that is a perfect-sized tendon. If that doesn't work, most of the time we use hamstring tendons now that have to be kind of cut down in the back table because they're awfully big. We used to use toe extensors, but the palmaris, if you've got it, is a great, great tendon. Unfortunately, now with the revisions we're doing, you have to find other tendons, either the other arm or hamstring tendons, when that time comes up, much like ACLs when you have to find a different tendon.
Let's talk about Hunter Green. I physically get ill when I hear any major league or anybody needs Tommy John. He needs it a second time. What does that entail, and how good does it work the second time?
Well, we know that Tommy John surgery in the right hands with the right rehab and the right people has a low 90s% of getting people back to the same level of play of when they hurt it. The second time we know is in the 60s, and unfortunately we have a couple that have had third time. With Hunter, the problem is this. What we find is, and we're doing this when we're doing a book with T.J. Antone, he named it something else, but it's speed kills. The problem is when you're in high school now, everybody's looking at velocity, everybody. And high school kids, when I was growing up, weren't throwing in the 90s. You might have had a 90, 91, and everybody was wowing about him. But now all these high school kids are throwing in the 90s because that's what the scouts want. Unfortunately, their bodies most of the time are not mature enough. And what we're finding is that they're injuring these ligaments, and you're not really figuring it out until a few years later. Much like the Little League World Series, where these guys are throwing breaking balls at a young age. You don't figure it out until they're in high school and college. So, number one, the velocity is getting you. Number two, when you've got a young guy, it's one of the reasons for a long time hard-throwing baseball players were not drafted out of high school. They were waited till they got to college, got a little bit more mature. A guy like Hunter Green throws 100 miles an hour with a revision Tommy John. He's a great athlete. He'll work hard. but you're flipping a coin and hope that he can get that same arm speed, velocity somewhere close to be an effective pitcher. It's unfortunate for him, but that's what happens when you throw hard. As you well know, you throw hard, right. Things happen.
Things rupture, like my labrum.
Well, they do. Absolutely, they do. And it's unfortunately, we found out, and as you were a closer, the closers really have the hardest time staying on the field for a long period of time because most of them are very hard-throwing guys that are pitching, if you have a good team, 2 out of 3 nights a week. And it just takes its toll on your body. So speed kills, fatigue changes your arm slot, places more stress on that ligament. And the harder you throw and the younger you throw, oftentimes without the great mechanics, you're really putting yourself at risk for injuring that ligament in particular.
Talking to Dr. Timothy Kremchek. All right, Aaron Judge, we have the Yankee games here on this radio station that we play, has a fractured rib. They even went as far as seeing if he needed thoracic outlet syndrome. What is the difference between a fractured rib and a vascular problem, and how do you do the thoracic outlet syndrome?
Well, the thoracic outlet, what it is when you're throwing, the nerves that come down to your arm and control the elbow and the shoulder all come from your neck. And oftentimes throwers have what we call a first cervical rib. Not everybody's got one. And the other people have with thickened and fibrotic scars we call the scalene muscles, which are right at the base of your neck, right over your collarbone. And when those scar in, and you're cocking back the pitch, it pinches on either the vessels or compresses the nerve. So sometimes you have to go. We try injections during the season, but if those don't work and rehab doesn't work, you have to open up and either take that rib out, which we call the first rib resection, or you go in and you have to clean out the scar tissue around the scalene muscles to open up the vessels and the nerves. It's very successful, but I'm sure the reason Aaron hasn't had something done is because they were hoping that he could get better. He's not a pitcher, which is great. But then also, the Yankees are going to be good enough, I think, and I hope, to get to the postseason. They'd rather have him at the end of the season in postseason go to the World Series. So, those we see that, and that's for hard-throwing guys, too. We see these all the time through the minor leagues, major leagues. They're tough to diagnose. And when you finally have to make the decision to fix them, you fix them, but it takes months to come back.
So as far as, sitting there waiting for, how long does that rib, you think, take to heal? Is everybody different?
Well, he has, my understanding is he has a stress fracture. And the difference between a stress fracture and a regular, say, broken bone, when you fall on it, a broken bone you fall on, it's going to heal. It's going to heal in 6 weeks, and you're going to be ready to go. Unfortunately, a stress fracture happens because of the continuous type of motion and stress you place on a bone. So that will heal, but when you start putting that motion back and doing it, it's going to fracture again, much like a runner with a stress fracture in their leg. Yeah, they can heal. But then when you start running on it again, you're placing the same stresses with the same mechanics. And so that's the problem. They heal in 6 to 12 weeks. Then you have to rehab it, but then you've got to change the way you do things, whether that's hitting, throwing, whatever it might be, so you're not placing the same stress on that bone. So I'm sure that's going to be something that'll probably be addressed at the end of the season when they have time. And unfortunately, this season we might have more time than we want before next season starts.
What is some of the newest technology or some of the newest methods to work on people, whether it's knees or elbows or shoulders, that you're seeing in place right now that you didn't see 30 years ago?
Well, first of all, I think number one, let's talk about the thrower shoulder. When I came up doing this, with the MRI, we could fix anything. I'm not bragging when I say this. I can fix anything in the shoulder. But what we've learned is that neglect is probably the best answer when you're talking about a thrower's shoulder. In other words, a lot of stuff he's going to find on an MRI, but you don't fix it that you would say in the general population, because if you do, they won't go back and throw to that effect. One of the greater things as far as the elbow is concerned is the internal brace. We're not only using the tendon to make a new Tommy John ligament in the inside of the elbow. We have this new synthetic brace that Arthrex makes that we do hybrids. We do a combination of both, which helps withstand some of the stress on the inside of the elbow, and it's more powerful construct. And I think one of the bigger things we're running into is we're learning how to do more aggressive and proper rehabilitation that doesn't stress the shoulder, the elbow, or the lower extremity to be able to continue the muscle mass. So rehabilitation, when you're talking about these athletes, not only is it prehabilitation before they get hurt, but once they get hurt, rehabilitation and has really, really come a long way to keeping these athletes on the field. People don't realize how hard it is and how grueling it is. You do, to play 162 games a year, 30 spring training games, and maybe the postseason. It is very, very physically taxing. And these guys do it year after year, especially the pitchers, and it wears you down.
I was going to let you go, but I got one more because I got a Yankee fan that I work with. Max Fried, same side, the pitching elbow, bone bruise. How does that happen? And it's happened a couple times this year. Is it mechanical or is it physical?
Well, it's both. Most of the time when you're talking about getting a bone bruise in the elbow, you're usually dropping your arm slot, oftentimes dropping that fatigue. It's shoulder fatigue, core fatigue as the season goes on. You drop your arm slot, you're placing a lot more stress on the inside part of your elbow, and that's where you get the bruising. So oftentimes guys just need to, and it's hard to do during a pennant race, take the time off, take the breather, build your shoulder, your core up, and then come back and pitch. But typically that's the answer. Now, it's great that he just had a bone bruise because the thing that comes after that is an elbow ligament injury, which becomes a problem. But I don't know this specifically, but we see this at the end of the year. Watch the relievers around Major League Baseball now. They're all pooping out. I mean, they've all thrown 50, 60.
I try to explain this to people, man. They're all gassed right now.
They don't get it. They're all gassed.
Nope.
And the pitchers that it used to be, even when you played, the pitchers were going eight innings, and then they'd bring the closer in. Now pitchers throws 5 or 6 innings. The quality start at 6 innings. You've got to have relievers ready to go 6, 7, 8, and 9, and that's every night. And you only have so many relievers. I think being a relief pitcher in Major League Baseball is an underrated job. It's the lowest paid, most likely, other than maybe a utility infielder, the lowest paid on the field that takes the most. It's taxing. I mean, it's very difficult to go in and throw hard like that 2 out of 3 nights a week, I think. And year after year.
I'm going to tell you a quick story. So, Larry Starr, the Reds trainer. So Norm Charlton and myself, when he wasn't looking, we would steal painkillers and stuff so that we wouldn't get put in the reports and stuff. I don't know how they do things now, but, he would always find out. Like he counted them in the little bottle in his little, trainer's kit. And he'd come up, quietly. And he's like, which one of you took the painkiller? And Norm and I would be like, how the hell did he know that? So, yeah, the trainers know every trick by us baseball players, and so do the doctors. And God bless you, man. You save so many careers and do such great work. And I'm, very lucky to know you, Tim. So I appreciate your time.
Well, I appreciate it, and I love your show.
Thank you.
By the way, I am a big Yankees. I'm actually a Booney fan because obviously I grew up with him when he was with the Reds, minor league system all the way through. So I'm always pulling for the Yankees. So let's go Yanks.
Awesome. Thank you, Doc.
Okay, buddy. Take care.
Talk to you soon.